House Coronavirus Task Force. Doctor, welcome back to Fox News Sunday.
Thank you.
A month ago, you and President Trump were both talking about a total of 60,000 COVID-19 deaths. Take a look.
It looks like we'll be at about a 60,000 mark, which is 40,000 less than the lowest number thought of.
Look at how much the model has changed in just a week. Remember, just a week ago, it was 80,000. Now it's 60,000.
Early this coming week, we're going to reach 100,000 deaths from the coronavirus, and those models that you're citing now talk about close to 150,000 deaths by August. What happened, Doctor?
I think a few things are together. So from the beginning, and I think when we had that first briefing, we talked about 1.2 million to 2.4 million and 100,000 to 240,000 people succumbing to this incredibly aggressive virus. Those are the figures that we continue to stand by in this first wave, and really understanding how to prevent future hospitalizations and future deaths is really what we're focused on every single day.
But to press it a little bit, a month ago, you were saying we were going to come down below the low end of the model, which is 100 to 240,000 to 60,000. So my question is, in this last month, did you underestimate the strength of the virus? Did we reopen too soon? Did we reopen without sufficient restrictions?
What I was saying in that briefing that you were talking about is what that current model was showing. There are different models we have been using all along, and really trying to learn primarily not just from models, but understanding what has happened in Spain and Italy and the UK, and really tracking those numbers. We understand that our mortality rates are less than those three countries, and that's really due to the incredible work of our frontline hospital workers. But we understand that these number of infections has led to this level of mortality, and our job now going forward is to do everything we can to prevent additional hospitalizations and additional mortality.
Well, let me pick up on that, Doctor, because this is, as we said, Memorial Day weekend, and people are going out more in public. A lot of them are going to beaches. We're running video here. Some people are social distancing, but the picture, as you probably can't see on the screen right now, in Venice Beach, California, big crowds of people, some of them close together, not wearing masks. How concerned are you by some of what you're seeing around the country this Memorial Day weekend?
Well, you know, last time we spoke, I was concerned about people coming together without masks, even during the protest. And now I'm very concerned when people go out and don't maintain social distancing. What do we know that has changed? We now have excellent scientific evidence of how far droplets go when we speak or just simply talking to one another. And we know that it's important for people to socially interact, but we also know it's important that we have to have masks on if we're less than 6 feet, and that we have to maintain that 6 feet distance. We know being outside does help. We know sun does help in killing the virus, but that doesn't change the fact that people need to be responsible and maintain that distance. We know you're talking to the governor from Arkansas. He's made it clear that there are super spreader events when people come together because of the nature of this virus and because of asymptomatic spread. And people aren't intentionally spreading the virus. They don't know they're infected, but they come together and they're under that 6 feet, and everybody who gets exposed to that person less than 6 feet has a chance of becoming infected.
So do you think some of this crowd of people at beaches this Memorial Day weekend, is that a super spreader event?
Well, Friday, when I discussed this during the press briefing, I was really hoping to convey that very clear message to the American people. We want you to be outside. We know that there are ways that you can even play tennis with marked balls so you're not touching each other's balls. We know there's a way for you to go out and play golf and spay distance, to hike, to be outside in nature, to be at the beach. But really within that is the absolute requirement, because across the country we know that there is still virus out there. And we see what workplaces are doing to make it safe. We see what nursing homes are doing to try to make it safer for their residents. Let's even in public make sure that we're doing everything that we need to do to make it safe for others in public.
President